Good afternoon and welcome to the Midday News. I'm Shamela Pula and here's what we have in the bulletin.
Jamaica Fire Brigade reports prank call surge. Nurses face verbal abuse amid worsening conditions. And later in sports, under-17 reggae girls draw first game against Guyana in World Cup qualifiers.
Now the details. The massive winter storm currently sweeping the United States continues to have an impact on travel in Jamaica. The storm has resulted in thousands of flight cancellations globally. The Airports Authority of Jamaica provided an update.
For Norman Manley, up to today, there has been 16 reported cancellations or announced cancellations, while for Sangster there have been 14 announced cancellations, for a total of 30 flights being cancelled into Jamaica from the United States.
Approximately 10 to 20 inches of snow was recorded in the northeast and the south of the United States. Citizens are now on high alert for dangerously cold temperatures. The Jamaica Fire Brigade says it's seen a steady rise in prank calls. JFB Commissioner Stuart Beckford is concerned that with more children having access to cell phones, they too are a part of the problem. Anthony Atkinson reports.
Firefighters across the island are raising concern about the growing number of prank calls to emergency services, warning that the trend is making it increasingly difficult for them to respond quickly and effectively to real emergencies. The Jamaica Fire Brigade says these malicious calls continue to divert crews, equipment, and manpower away from genuine incidents.
For example, between 2021 and the end of 2025, we would have received a total of 8,277 such calls, representing a 131% increase over the last 5 years. In 2021, we had 1,174, and it has steadily increased to 2,711 for 2025.
Speaking with the TVJ News, Commissioner of the Jamaica Fire Brigade, Stuart Beckford, urged the public to desist from the practice. He revealed that there has been a steady rise in these false reports over recent years.
One of our units was sent on a wild goose chase way up in the hills of Clarendon, Kellett's back that side. And on their way back, they were involved in a serious accident with a delivery truck. And that put that unit out of use for an extended period because it now had to undergo repairs. And so that is just one example.
Commissioner Beckford is also appealing to parents and guardians to speak with their children about the serious consequences of making prank calls, especially as more youngsters are being given access to mobile phones.
We're living in an era where telephone now is really something that is important for persons, not only to keep in touch, but for research purposes, just to access basic information. So we understand the need for that. But what we would encourage parents to do when they are giving the phones to the youngsters is to encourage them not to use it, to make mischief.
He is reminding the public that emergency lines are reserved for life-threatening situations and should be used responsibly. Anthony Atkinson, TVJ News.
There's been a decline in road fatalities so far this year. According to recent data, since the start of 2026, 19 deaths have been recorded. This is compared to 28 reported at the same time last year. Speaking on TVJ's Smile Jamaica Monday, Dr. Lucian Jones, Vice Chair of the National Road Safety Council, stressed the importance of wearing seatbelts no matter where one is seated in a vehicle.
Put road safety at a priority, at the same level of murder. We're carrying on murder, thanks be to God, but we need to pay the same attention to road safety. And unfortunately, this has not been so. The reason why we're having so many deaths is because you have unsafe roads, people are driving at unsafe speeds, you have unsafe road users. Data coming from Ministry of Health, Dr. Tamo Davison, last week Thursday, of those who were injured in 2024, 18% of women and 20% of men who were injured were not wearing a seatbelt. They're not buckled up. There's a phenomenon in this country where you believe that if you drive in a car, you don't have to buckle up in the back seat. That's madness. You need to be buckled up both in front and in the back.
Dr. Jones pointed to research showing that the majority of road fatalities last year involved young people, highlighting concerns around testing for marijuana use among both drivers and pedestrians as part of efforts to address road safety.
Driving under the influence of mind-altering substances, including alcohol and including ganja. I'm tired of hearing patients tell me about going into a taxi and the taxi man has a big head spliff of ganja in his mouth and a glass in his hand. You know about special?
Mm-hmm.
Okay.
I don't drink, by the way. But
well, that one thing's now. So boom and alcohol. It's a dangerous combination and people are smoking and drinking and driving. It's madness.
Despite assurances from the health minister that infrastructure upgrades are coming, the Nurses Association of Jamaica says it's still waiting to see real action. The association's president, Dawn Marie Richards, says in addition to worsening conditions, nurses are being verbally abused by patients and their relatives.
I ask the members of the public to be patient with the nurses when they go into these overcrowded spaces, because the challenges that they are facing are not directly related to nursing. Nurses have we don't have any control over providing bed space and physical space for clients to work, to be in. We don't have the control over providing equipment to utilize on persons. So we're asking people to be patient with the nurses when they go into these spaces.
At the same time, she says while nurse migration continues to affect the health sector, the exodus is not as severe as in previous years. Even so, the NHA president warns that without urgent and meaningful intervention, the conditions driving nurses away will persist.
The issue of nurse migration continues to be a concern, but we don't have much control over that. We look at the changes that are taking place in immigration practices across the U.S., and that in itself may be posing a challenge, but I know that persons are still processing.
Health Minister Dr. Christopher Tufton says significant improvements have been made to access at the Bustamante Hospital for Children. Dr. Tufton says parents and guardians are now able to spend more time with their children who are patients at the facility. He was speaking recently in an interview with TVJ News.
The truth is we have been considering that even before. I visited the Philippines where it is a policy where every sick patient has the opportunity under certain circumstances for a loved one to be there. It's a big thing, especially for children who are traumatized when they're in hospitals. So we have now created a pilot project which will see a parent or guardian under certain circumstances being able to stay with their loved one up to 10 p.m. at nights. What that will mean is that parent or guardian can provide comfort, psychosocial support, and under the guidance of the clinical team can also do other things, read to them, feed them, clean them up, which we believe will help the healing process significantly.
The health minister also revealed that a 15-bed facility will be completed soon. The space is intended to accommodate parents and children who travel from outside the area to seek care at the hospital.
There was some pre-planning that was necessary, which is to ensure that there are sanitary conveniences for the persons who are staying there, and that they conform to certain rules and so on. There's a little tutorial that they would have to comply with and sign before they have access. But it's a very positive step in the right direction towards the healing process. Beyond that, in another few weeks, we will open the overnight facility at the Bustamante Hospital. That facility started construction about a year and a half ago.
There are renewed calls from advocacy group Jamaicans for Justice, JFJ, for the government to strengthen the Access to Information Act. This comes after long delays or, in some cases, unfulfilled requests for information that should be accessible to the public. Alia Bryant has the details.
The Access to Information Act gives citizens and organizations the right to request official documents from government bodies. Following a comprehensive review of the Act for 2025, Policy, Research and Advocacy Specialist for Jamaicans for Justice JFJ, Jade Williams, says one of the biggest challenges is ensuring government compliance with the legislation.
When you make an access to information request, it must be acknowledged that when it is that the request is made, you have a 30-day time period in which to wait for that information to come to you. That period can be extended up to 60 days, but what we found was that only 30.6 of the 111 requests that we would have sent to 101 agencies would have been fulfilled within the 30-day time period. Besides that, we would have had 30.5 fulfilled after the 30 days and 37.8 that remained unfulfilled.
Now, while acknowledging improvements in compliance over the years, she says more work is needed to strengthen access to public information. Another challenge identified was the right to access certain types of information.
What happens is that we have these kind of blanket exemptions that for the majority cannot be challenged by the fact that the public might need this information. And so we would have recommended to see where there's a general public interest clause that would apply to all exemptions, and therefore we can always run that test of balancing the public interest and keeping the information confidential as necessary.
Ms. Williams is appealing for the Act to be revised, stressing that for the legislation to be effective, citizens must have efficient access to submit their information requests. The Access to Information ATI Act was passed in June 2002 and officially took effect on January 5, 2004. Alia Bryant, TVJ News.
It's time for a break. Stay with us. More stories when we return. Welcome back to the Midday News. It's now time for the Business Minute.
The Small Business Association of Jamaica will sign a memorandum of understanding with Lasco Financial Services this week to provide affordable financing for small businesses affected by Hurricane Melissa. President Garnet Reid says the agreement aims to make credit more accessible to operators who are struggling financially after the storm. He noted that many small businesses turn to private lenders because of the high upfront costs of accessing Development Bank of Jamaica financing, which can reach up to $800,000 before audited financial statement costs. However, Mr. Reid says talks are underway with the DBJ to allow those fees to be rolled into loans, reducing the burden on borrowers before funds are released. Further afield, the price of gold has crossed a threshold never seen before. Gold prices surged past $5,000 an ounce for the first time on Sunday. Analysts say the spike in price comes amid worries U.S. President Donald Trump is upending relations between the United States and its allies in Europe and Canada. That is causing investors to stick with a reliable asset like gold. And that's it for the Business Minute. I'm Prince Moore.
And it's time for the top regional and international stories.
In the region, health authorities in Barbados are reporting a rise in syphilis cases and are urging residents to protect their health. Early symptoms like sores, rashes, or fatigue may go unnoticed, but untreated syphilis can cause serious problems, including heart and brain damage. Pregnant women risk miscarriage or illness in newborns, but early testing and treatment can prevent this. Officials urge residents to get tested, use protection, and notify partners if infected. And on the international scene, flight cancellations are surging as a treacherous winter storm batters 2/3 of the United States. Officials say this is the highest number of flight cancellations since the COVID-19 pandemic. More than 800,000 customers are without power from the storm. At least 20 states are under emergency orders as the bitter cold lingers. And those were the top regional and international stories. I'm Aaliyah Bryant.
Thank you, Alia. We head to a quick break. When we come back, we'll have your midday sports report.